So if we want to summarize the circulations in the brain, there are two circulations in the brain. There is a blood circulation, which is already very well known, which is the circulation of the blood in the artery, capillary, and veins. This circulation is regulated by the neurovascular unit, which allows the permeability of the blood-brain barrier. In parallel to this circulation, we have the glymphatic circulation, which is what I described on the previous slide, the circulation of the CSF along the arteries and the vein. And this circulation is not only involved in the feeding of the brain, but also in the clearing of the brain from its metabolites. And this circulation ends up in the lymphatics, but probably also in the vein. So this is what we will discuss later. But these two circulations for sure converged at the dural venous sinuses. And this is very, very interesting because idiopathic intracranial hypertension is a disease of the dural venous sinuses. So we have to consider the circulating lumen of the dural sinus, but we also have to consider the wall of the dural venous sinuses, which is the perisinus. In this perisinus, a lot of things happen. I will describe this in the next slide. But as you can see, if you consider the vascular circulation, you have the lumen of the cortical vein here. And here you have the perivenous space with the brain metabolites, which are excreted here. And all these converge at the dural sinus. But we don't know exactly how the connection occurs.